Good morning, class. Today we're going to continue our conversation about diabetes. The objective that will be met today is students will list predisposing factors and general symptoms of type 1 and type 2 diabetes after reading pages 404 and 405 in the Disease Identification, Prevention, and Control textbook. And then we will compare and contrast the difference in predisposing factors and what the general symptoms are on a separate sheet of paper. The National Health Education Standard that we met today is Standard 1. Students will comprehend concepts related to health promotion and disease prevention to enhance health. Can anybody tell me what you learned from the previous class? Yes, that's correct. So what Laura learned from last class was that diabetes is one of the 10 leading causes of death from disease in the whole entire United States. Does anybody have another fact that they learned from last class? Go ahead. Yes, that's correct. So what Brian learned is that diabetes is the direct result of insufficient supply of insulin, or it could be an inadequate use of insulin supplied to the pancreas. Now I have 3 more things that we could list for what we learned from the previous class. Can anyone tell me what else they learned? Go ahead. Yes, that's correct. A lot of people don't know that either. So basically, diabetes contributes to 50% of myocardial infarctions, which is basically a heart attack. Does anybody have any other facts they learned? Go ahead. Yes, that's correct too. And diabetes also contributes to 75% of strokes in the United States. Now there's one more fact I'd like to put on the board. Can anyone tell me another fact? Yes. That's correct. So basically, diabetes is also a contributing factor for renal and peripheral vascular disease, but also blindness. Now, we've talked a lot about different facts about diabetes so far in class today, but I kind of want to take a step back and think about what diabetes actually is. What does it mean to you guys? Yes. Now, there's one more abnormality in just that. What do you think it is? Correct. So basically, diabetes is an abnormal metabolism of carbohydrates, protein, and fat. This results in increased levels of blood sugar. That's why you'll see a lot of people who have diabetes checking their blood sugar a lot of times. All right. Now, what are the two types of diabetes? Can anyone tell me? Yes. Yes, that's correct. So the first type is type 1 diabetes, which is also called juvenile onset. Can anyone tell me why it's called juvenile onset? Yes, go ahead. That's correct. It's called juvenile onset because it usually occurs between adolescence and before the age of 35. Now the second type is type 2 diabetes. Type 2 is normally called adult onset diabetes because it usually occurs after the age of 40. Now I would encourage you to write some of these facts down because we will have a quiz in the next couple of classes on this material. What we're going to do today is we're going to have a little in-class activity. You should all have your textbooks as we bring every single day of class. We're going to go ahead and read pages 404 and 405 in our textbooks. I'll give you about 10 minutes to go ahead and do that. And once you are done, go ahead and close your textbooks so I know you're finished. Alright, it looks like everyone's just about finished. Go ahead and take out a separate sheet of paper, and when you are done, just look up at me, please. On the sheet of paper, I want you to draw a Venn diagram. And on the first circle, you're going to write up top type 1 diabetes. And on the second is type 2 diabetes. Now in the textbook, you just read about predisposing factors with diabetes, but also the symptoms of diabetes. Can someone give me one factor they read about type 1 diabetes? Go ahead. Correct, and there's some studies, but not a lot, so it's generally thought to be hereditary. Good job. And can someone tell me a factor with type 2 diabetes? Go ahead. Correct, with their sedentary lifestyles. So basically, if you're obese, then that is a factor. And if you live a sedentary lifestyle. Now, someone mentioned earlier that heredity was also a factor with type 2 diabetes, and that is correct, so I'm going to go ahead and put that in the middle of both. Now in your textbook, it also explains some symptoms of both type 1 and type 2 diabetes. Can someone give me just one example of a symptom of type 1 diabetes? Yes. That's correct. So with type 1 diabetes, it's usually an abrupt onset. There might actually be some symptoms that you realize, some you won't. For type 2 diabetes, can somebody give me a symptom as well? Correct. Unlike type 1 diabetes, type 2 diabetes has a gradual onset, so it's not all of a sudden. Now I have a question for you guys. What symptom do both type 1 and type 2 diabetes have in common? Go ahead. Yes, that's correct. So there's frequent urination.